Our next guest, Ronda Wimmer, is a doctor of Oriental medicine and specialist in sports medicine also. She's an adjunct professor here at Chapman University teaching Eastern perspectives. Dr. Wimmer founded her own practice in Newport Beach called Cutting Edge Integrated Medicine. Welcome, Ronda.
Thank you very much.
Rhonda, thanks so much for coming. You know, this is a great topic for me personally because I think we use so many drugs these days and there's so much toxicity with drugs and the cost. If we could find a great alternative like acupuncture to treat so many diseases, it would be a great help to society in general, great help to Western practitioners like myself and to the public. So can you tell us what are the most common illnesses that you treat with acupuncture these days?
Well, yes, a lot of them is pain management. That's number one, especially with evidence-based. But acupuncture treats a lot of internal medicine conditions. To name a few, you know, endometriosis, we have menopause, acid reflux, diverticulosis, diverticulitis, many others among those. It's pretty comprehensive, actually.
Yeah.
Recently, I took a trip to Ronda's office to learn more about Oriental medicine and acupuncture.
The premise of the treatment today is to counterbalance your entire system. Although you're tied up here, which means in Chinese medicine you have blood and qi stagnation, what I'm going to be doing is doing acupuncture, and what acupuncture's going to do is it's going to move the blood and qi in the area. The needles themselves are individually wrapped, they are not reused, and they're disposable. In other words, we throw them away when we're done. And I'm going to balance your body by using the acupuncture needles to move the energy or qi in that particular area. And if it's Western philosophy, then I'm going to move the blood and stimulate the sensory neurons to create the opiate pain control theory, which is the release of B endorphins and enkephalins. Acupuncture is a lot more than just putting needles into painful spots. We stimulate we balance and stimulate the entire body systems and how they work synergistically together. And that's really the big difference with Chinese medicine and Ayurvedic medicine. The idea that it's a synergistic approach to treat everything, not just the signs and symptoms. I usually will leave the needles in anywhere between 20 and 30 minutes. What cupping does is it brings blood to the surface. I just wanted to show how we can kind of move the qi and blood by using cupping. And this is one of the more popular methods to use that increases qi and blood in the area. Now, what's going to happen is on your back, you'll have blood in the area, which will look like hickeys. And people are like, oh my God, what'd you do? But all it is bring the blood up in the area, much like a hickey would. These are ready to come out because the qi has arrived, and you can tell by where the needle pricks are. See how it's red? See how there's little circular red areas around the needle? It means the qi has arrived. And then on the left side of your back, where I have circles from where I put the cupping, I got qi to come to the surface. So we're ready to take these needles out. Here I'm going to sedate it because I have a lot of excess in the area. So I'm going to slowly pull the needle out. And what that does is that sedates the area to be able to get rid of a lot of the excess, kind of drain it, if you will. How's that?
Perfect. Oh, very nice.
That was really interesting. Rhonda, are there any other things that you can use to simulate the effect of a needle, like electrostimulation or other types of modalities that instead of a needle you use something else?
Oh, in Oriental medicine, there's all different types of ways to stimulate what we call qi. And one of the things we can use magnets. We use EAS or pens, electroacupuncture stimulation, where we'll take and put electrodes up to the needles to stimulate the needles. We use moxa.
What is moxa?
Moxa is an herb that we burn, and we burn it on the needle.
Oh.
And it really stimulates the needle. It's a lot of fun.
Now, does the needle get hot when you're burning the moxa?
Yeah, it does a little bit. It stimulates the needle, but not like hot, like boiling.
Like boiling.
Yeah, exactly. We have what's called gusha, which is scraping. And we also have what we call qigong exercises. We have exercises just like you would have in physical therapy that are specific for different conditions. So it's really quite neat. And one of the biggest factors is food. Food plays a huge role in being able to counterbalance the body and bring it back into homeostasis or balance.
When somebody comes to you for acupuncture treatments, then they also get dietary instructions, exercise instructions, or
Most
no?
definitely, yes.
So it's usually this comprehensive
Oh,
package,
very comprehensive.
not just acupuncture, acupuncture, diet, exercise.
Oh yeah,
the whole
very
nine.
synergistic, most definitely.
In my practice as a cardiologist, we have stimulated various nerves to regulate heart function. Years ago, we used to have you put your head in a cold bowl of water to stimulate the trigeminal nerve, which would slow down or break abnormal heart rhythms. We would press on the eyeballs or press on the carotid nerve right here. So to me, it makes sense that this would work, and it would be nice somehow to get the message out so it can be more accepted with Western trained physicians. How good is it to treat things like, besides pain, like high blood pressure or diabetes, or have you had any research with that type of diseases?
Oh, very, very effective. You know, again, we look at the whole body, and so we use, in many cases, a combination of herbs, food, and acupuncture simultaneously.
Okay.
In this culture here, we use a lot of herbs with acupuncture simultaneously. Very, very effective because we're counterbalancing the body. And probably one of the key things to remember is that when we're looking at the body as a whole, I always say physiological manifestations, pain. But if I were to show you a chart that was a muscle chart, and I put a transparency over it, we're looking at the muscle chart to see what's going on, but we're really treating the transparency. We're balancing out the transparency, and then we see, when we balance the body out, then the symptoms go away. So it's very different from treating symptom-based. That's not how this is used. This is not a symptom-based treatment. It is looking at, well, what's the problem, and then balancing out the body as a whole.
The whole body.
Yeah, yeah.
Now, when you say you use herbs in conjunction with the acupuncture, do you take this? Do your patients take the supplements first and then come in for the acupuncture, or vice versa, or
No,
how does that work?
They do them at the same time.
Oh, they take them at the same time.
Oh, yeah.
Oh, okay.
Oh, yeah. Get acupuncture, send them home with herbs for a week or so.
Uh-huh.
Have them come back, reevaluate where their system's at, and it changes. So we put them on different herbs, or we fine tune
You
the herbal
tweak.
formulas. Yeah, exactly. But the key thing that I think people need to realize is that this is individually based. It's not a protocol. You can't just come in with symptoms and everybody gets the same treatment. That's the problem, is from a academia standpoint or from an evidence-based standpoint, we tend to look at things from a single variable. Now, in pain management, they've been able to identify through MRIs and whatnot, we call the opaque pain control theory, release of B endorphins and enkephalins by stimulating, the acupuncture stimulating the nervous system. However, that's a secondary or tertiary response.
Say somebody came to you and or another acupuncturist, how do they know what they're doing is really working? I mean, should you expect pain to be relieved in 5 sessions and maybe high blood pressure in 10 sessions? I mean, is there a certain type of disease that responds the first session and other types that you have to have faith and go on for many more? How do you, what's your experience with that, the response of different disease states or different symptoms?
Well, as with any medical professional, you have what we call a gauge. We have our own gauge, our own scale, and everybody has a different scale. It's how you become consistent. And every person is different. You know, it's hard to say, well, it'll take 5 days, because everybody's different. Some people will feel it immediately. Some people a couple of days. Some people, if it's, in our case, chronic is 30, 40, 50 years, not 72 hours, or 6 weeks, whatever, acute, subacute, and then 6 weeks. Ours is, 10, 20, 30, 40 years. And so depending upon how long it's been, that will then give us an idea, once they come back in the second and third treatment, we know which way to go with it. We'll say, this is where they're at now, so we need to go this way, or this is where they're at now, and then we can kind of gauge it better once we see them the second or third time.
Say somebody has high blood pressure and they're on medications and they came to you. Do you leave them on the medications and then do the acupuncture? I mean, how would you handle that situation? Or do you tell them to stop the medicines and then do the acupuncture?
Oh, heavens no. I never tell them to stop medication. The first thing that I would do is I would treat them and to see how they're doing with their meds.
Okay.
And then I would refer them back to their doctor, and let their doctor check them out and let the doctor feel what they want to do with their blood pressure medications. But, if we're seeing great response, which we've had this happen before where, I've treated patients and they've gotten a great response and their docs lessened their blood pressure medication. So, and they're like, how'd you do that? And I've been getting acupuncture and taking these herbs. And we have to also look at herb pharmaceutical, what we call interactions. And a lot of Chinese medical doctors and licensed acupuncturists are trained in this. You know, so, you know, people should be aware that, you know, herbs are prescribed. These are prescription herbs. In other words, we diagnose them, we give them specific herbs for specific conditions. Exactly. If you just go to the store and buy them, you know, that's 50-50 crapshoot.
That brings me to my next question. If a person goes to a health food store, let's say, and buys you know, various herbs because they've read a recent periodical, is that kind of dangerous in terms of not really knowing what the effect could be on their body or with medications they're taking?
I'm not going to say it's really that dangerous, because usually the amount that's in the store is not that high of an amount, okay? It's not that concentrated.
Okay.
However, what I will say is, one thing I know from Ayurvedic medicine and Chinese medicine is that you have to diagnose the person individually using the philosophy with which it is used. If you do this, then that treatment that you're using is specific to that person. That is a key point. You know, if a person just goes in and says, hey, I have this, and they go use herbs, again, 50-50 crapshoot on whether or not it's going to work or not.
Exactly.
You know, so it's a guessing game, and to me, that's not specific enough. You know, can you do a few things? Yes. You know, small things, but you should really go to a qualified professional to get diagnosed.
So this was a great discussion, very, very interesting. I mean, I'd like to see some of my patients become more involved with acupuncture. Thanks so much for coming.
Thank you very much.
I so appreciate it.
Pleasure.